now here's your other option. It's basically almost the same position, but we're doing ER. We're going to hold this for 30 to 60 seconds. And again, make sure that I'm not getting an end feel at her knee. Okay, I want the end feel to be in hip rotation. So I should feel with this hand, I should feel her femur turning. Okay, not applying a stress on her knee. Right? The tibia and the foot, the fibula, are going along for the ride. Okay, so this would be external rotation because the femur is turning outward. Okay. And then this, and again, I want to be monitoring the hip rotating. This would be hip internal rotation. And the stabilization is coming from the table and her body weight. Because I don't have free hands. Okay? So I got to protect her knee, move her, but make sure I'm getting an end feel. The resistance should be at the hip, not the knee. Okay, so Jules, you okay feeling anything at your knee? Okay. Does that make sense? The third option would be for you to go onto your tummy. And just for the sake of demo and video, I'm going to switch legs. Okay? We are treating the right side with our patient. Alright? And so now I'm going to bend the knee. Okay? I'm going to stabilize the hip. Alright, and I'm going to get an end feel and internal rotation. Okay, I'm going to ask my patient if she's feeling anything at her knee. I don't want that. Okay, maybe a slight bit of stretch in the anterior lateral hip. We okay? Remember the TFL and glute min are the internal rotators, okay? The piriformis and the 6 deep and the glute max are your external rotators, okay? So when I'm internally rotating, maybe a little bit of stretch in this area. And again, I'm not going to stretch Julie. She's got 45 degrees, okay? It's very hard to stretch normal joints. Just looking for your body mechanics and your hand placement. Okay? If we go in this direction, that's hip ER, external rotation, and that's where she should feel it. And I can actually see her hip lift a little bit, so I got to do a better job stabilizing. Really well. All right, you good? So you should almost feel the stretch right where my fingers are. Okay? So try 3 options for IR, ER. 1 30-second stretch each direction, each position, then switch. Okay?